Hi, I'm David Liew, rheumatologist in Melbourne, Australia, reporting for Room Now for ACI 2020. Just want to tell you a little bit about one of the really interesting abstracts from the plenary session about interstitial lung disease and pregnancy, in particular, interstitial lung disease secondary to rheumatic disease. Some really interesting data from Duke, from Megan Klaus's group. And it really gets to this question about what to do with these patients, especially when we know that the diseases that cause interstitial lung disease often affect women of childbearing age. Women often want to have children, but we've always been taught that interstitial lung disease and pregnancy are bad. We know that there are pulmonary changes which can be problematic and the oxygenation can get compromised, but there are circulatory changes as well, and patients with ILD can decompensate really quickly. So the paradigm's always been, when you're talking to an ILD patient about pregnancy, that you should really talk about considering, do they actually want to get pregnant? And there have always been questions about maybe even we should be considering elective terminations for some people. So it's all quite extreme. And we've really lacked real world data. So Megan Klaus's group have described the biggest cohort so far to date. And they've narrowed it down to the rheumatic disease patients, and they've got 94 babies in that cohort. What's really interesting out of that is looking at the pregnancy, the fetal outcomes, and the maternal outcomes. So the fetal outcomes, especially for severe interstitial lung disease, not so good. Really, we saw lots of complications in that severe ILD group and lots of fetal loss, in fact. In the 7 patients from the severe ILD side of things, 4 of them, unfortunately, were non-live births, and there were complications right throughout. What was interesting, though, was that the maternal outcomes were really good. No deaths, no real complications, only 1 ICU stay in someone with mild ILD, and that was from an asthma flare. And so it really speaks to this idea that actually perhaps there's not an enormous amount that's going to be lost from trying to get pregnant or go ahead with pregnancy, that these women actually are safe within themselves, and really the risk is a fetal risk. So I think that's really changed the way I think, and I think that's changed the way a lot of people think. So for that, plenty more on pregnancy in rheumatic diseases and all of what's happening at ACI 2020, go along to roomnow.com for our ACI 20 coverage.